What's your PMD?
10-4, 1051.
This is Denise with Medi.
America's healthcare system is in crisis, and things are likely to get worse as demand for better healthcare services increases. The way our current healthcare system in the U.S. deals with a patient's vital information and how it is organized and used remains frighteningly antiquated. According to a 2006 survey, only 1/4 of hospital leaders surveyed reported that their organizations have a fully operational electronic medical record system. Paper medical records make it nearly impossible to maintain a patient's complete medical history, putting them at risk for misdiagnoses and dangerous drug interactions. In many cases, physicians also have the legal right to dispose of patient records after several years. Unfortunately, most patients don't know they have the rights to these valuable records.
The patient has rights to everything contained within their medical chart. The actual chart itself is the doctor's property, but all information and copies are the patient's. It's their right to have all information that's documented. And the importance of that is patients go from doctor to doctor, hospital, and with traumas, they can never be expected to remember everything contained in their medical history.
Even if physicians closely guard their patients' medical histories, the records may still be at risk. Floods, fires, tornadoes, and hurricanes are notorious for destroying medical records. In fact, nearly 1 million people lost their entire medical history following Hurricane Katrina.
I was in the emergency rooms during the aftermath of Hurricane Katrina. I remember the chaos that existed when patients presented dependent on medicines or other medical care. The doctors' offices were closed and they didn't have access to their records, whether they were digital records or paper records. These patients didn't have their medications. They didn't know what medications they took. They didn't know the name. They didn't know the dose. They were presenting in an emergency.
When was the last time you had an X-ray? How about lab tests? Do you remember where you had these tests done? Do you have a copy of the results? Would you know where to go to get them? One company has risen to meet this challenge head-on. With a mission to link the patient with their medical history, MedeFile has created a way to give the patient control over their individual health care and the decisions regarding their treatment.
What MedeFile does when somebody becomes a member is goes out, gets all of the various components from all the doctors and all the hospitals and facilities that a patient may have been at, consolidates it, and has it ready 24 hours a day, 7 days a week for use should it be needed.
This new technology empowers the individual with the ability to control the exchange of their health information.
MedeFile's procedure is rather simple to the member. With very little information supplied, such as doctors' names and telephone numbers, our system goes out and gathers all of their actual medical records from the various pieces of information given to us, consolidates all of that information, indexes it in a medically correct form, and places it in the member's MedeFile. And it's ready to be used 24 hours a day, 7 days a week.
Every MedeFile member's account contains a digital health profile, which contains information about the member's physicians, insurance, emergency contacts, medical conditions, medications, allergies, and family history. It can be extremely difficult, frustrating, and time-consuming to collect all of your records from your healthcare providers. So the MedeFile team will contact your doctors on your behalf and do all the legwork for you. They will collect, digitize, and index all your medical records into an easy-to-read, user-friendly format. You can also carry your entire medical history with you wherever you go. A specially designed flash drive, the MedeDrive, holds your emergency medical information and your entire medical record. When plugged into the USB port of a Windows-based PC, this username and password-protected device provides vital life-saving information to emergency medical personnel.
I know with 20 years of experience in the fire and emergency service field that having accurate information is paramount to any critical emergency scene. Many times we respond to emergency calls where bystanders are not available to give us critical, accurate information. With MedeFile, all we need is a computer and we can access this information to give you a baseline history on a patient's condition.
Not only does the patient benefit by having an information hub, but it enables the healthcare community to have a much broader view of a patient's healthcare-related activity, such as other doctors they've seen, tests they've had, and medications they've taken. This could be potentially difference-making information in the treatment process, and it may mean better outcomes for the patient.
The most important part of a patient's physical examination is the history. The more information presented to us, the more valuable it is for us to obtain and make and render a proper diagnosis. When you're talking about medications, possible surgeries, contraindications to medications, that medical record and that component of their history can save lives.
With the MedeMobile enhancement, you can securely access and fax your emergency medical data and your medical records directly from your smartphone, PDA, or internet-enabled cell phone. As the health information technology revolution progresses and the public takes more control over their medical records, healthcare providers will make more well-informed decisions, which will result in better quality care.